Hi guys, welcome to episode 11 of Mimi's Friday Rants. Though today we will not be ranting about anything, but we are going to be sharing knowledge. And today I want to talk about rhesus factor. Rhesus factor is in simple terms, what it simply means is a deficiency in the blood that actually cause women to have miscarriages or issues when there's a trigger between both the positive factor and the negative factor. Yeah, a lot of us don't really know anything about it, but I would advise that once you are pregnant, at early stage, I think majority of the hospitals now actually run tests to know if you are RH negative or you are RH positive. But about 80% of people in the world are actually RH positive. So leaving the 25% to leaving the 15% to those that are RH negative. So why this rhesus factor is very important is this: first of all, we need to test the protein level in the pregnant woman blood cell. That is why we have the 85% that are positive. So if the woman is positive and the child she's carrying is negative, automatically we brings us to number two. So that means she will need to take a shot called the immunoglobulin shot so that it will help her to reduce the bodies that she produces so that it will not affect the child, because we now have both positive and negative regents in one body trying to make sure a little baby survives. So without that shot, that pregnant woman can lose the baby. There can be deficiency in the baby. There can be a lot of things that can trigger. So I would advise that we should go and read more about rhesus factors so that we'll be able to know, because it is a lot. It is something that we mostly don't talk about, and when we don't talk about it, people don't even know that these things happen. You might be somebody that it has happened to and don't know that it has happened to you, but for subsequently, we should know our status when it comes to the rhesus factor situation so that we'll be able to know when to do what and how to do it. And it doesn't restrict it to just the female. The male can equally help the female with a reminder so that they will know exactly what it is. I don't really know, I'm not an entity on this, I don't really know much, but the little I know that these tests are run early during the early weeks of pregnancy on women so that they will know if it's positive, that means simply means that the woman does not need any shots, she does not need anything, she does not need to be protected from anything, she's fine. But if it's she's carrying a child that is negative, or she's negative, she's carrying a child that is positive, automatically there's going to be a problem. So she has to be taken care of. So don't worry, it's not a death sentence, it's not something that you're going to die about. It's just something that you need to know so that you can protect yourself and protect the child. Mostly it affects the child. So I think if we want to get better children or want to get children less of defect or any one or two things, we should try our possible best to get tested so and know what to do and what not to do. So today I think we just shared the knowledge. So I will advise that both male and female we should go, we should find out, we should we should dig in informations about these things so that we'll be able to know how to do it in the nearest future. Thank you guys for listening by. See you later.